10,000 grafts. Yes, 10,000 grafts. Have you seen that many? Hi, I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. And today we will be talking about what real hair transplants need. If you have a significant hair loss, means if you are bald till this portion, or you can say that if you are half bald, in scientific terms we call that Norwood 5 or even Norwood 6 bald, then how many grafts should you be aiming for? I know a lot of charts say maybe 3,000, maybe 4,000, maybe 5,000. But remember, those charts were made using technologies that were 15 years old. They were made when beard hair was not routinely used for transplanting on the scalp. That was a time when there was a severe limitation of donor hair. But you are not living in 2010. This is 2022. Right now, in my view, the average donor session of a graft session should be at least 10,000 grafts if a patient is Norwood 5 or more. Now I'll explain to you why I say this. It's very simple. Never ask your doctor how many grafts I need. Ask your doctor how many grafts have I lost. Once you know that, then you can decide for yourself how many grafts you want to go for. So we'll do a small tiny mathematics. The full head before hair loss contains 40,000 grafts, 40,000 grafts. If you are bald from hair to hair, this level, that makes 50% bald. Only this much will make 25% bald. So that is all which you have to see. If you are half bald, that will be a Norwood 5 level. That means half of that 40,000 grafts are gone. Means nature given 20,000 grafts are no more. So will you replace them by just 3,000 grafts and expect to have a wonderful looking head of hair? I don't think so. Check out the old textbooks. You will find that grafts were placed in a particular manner to create a very fragile illusion of coverage. Meaning, grafts were placed in such a manner, maybe high up here, and just comb it in this way so that it looks as if you have hair. But in 2022, we don't have to be bound down by those old technologies. Now you have at least aim for 50% replacement. If you have lost 20,000 grafts, at least aim for 10,000 grafts to replace them with. Now the question should be, what happened between 2010 and 2022? A lot of improvement in technology happened. And it's not just about the instruments. It's about the increasing experience of the doctors. It is about the increasing experience about the donor areas also. Imagine the first transplant using beard hair to scalp by FUE was done in 2006 at our clinic. Before that, beard hair had not been used. And beard provides a rich source of donor. You can cover your head using half your beard. But of course, you won't use only the beard. So, for now, understand that if you want a good hair transplant, you want a hair transplant that is as thick as possible. And when I say as possible, the limiting factors are whether you have donors available or not. Means, do you have enough hair on the beard which you are willing to donate? Do you have enough hair on the back and sides? Only this part which you are willing to donate? Are you willing to use your armpit hair if you don't have that much beard? Whatever hair is strong and long, we can use it to refill your scalp. So if you had a choice, forget about money or expenses. If you had a choice that yes, I am this bald, and I have two choices, I can get 4,000 grafts placed here or 10,000. Naturally, you will go for 10,000. So why settle for something less just because your doctor or your clinic does not know how to do? Right now, the limiting factor is that clinics or doctors that can do 10,000 to 20,000 grafts are limited. I can count them on one hand. on fingers of one hand. So choose wisely. Don't settle for an outdated technique or outdated method. Don't fall for gimmicks or word games. Look at the graft numbers, not even follicle numbers. Look at the graft numbers and ask, if the patient had lost 20,000 grafts, why are you putting only 4,000? Then you will have the answer. Then you will be able to choose the best transplant for yourself. So remember, 10,000 grafts is a possibility. Almost any Indian with even an average beard and head donor, we can do 10,000 grafts for them. Maybe in multiple sessions, but yes, it is doable. So nothing less than a good thick head of hair should be your aim. If we cannot give you, we should be telling you, okay, we can't do it because we don't have the technology, because you don't have the donor or something. It shouldn't be that, okay, we will not tell you how much you have lost and we'll put whatever we feel and that will call your graft estimate. That is wrong. So if you have a confusion about your actual graft estimates, even if you don't want to come to us, I'm not asking everyone to come to me. You can send your pictures, WhatsApp us, email us. We'll let you know how much grafts are required. And remember to like and share and subscribe this channel. Sharing is very important. It really helps people. Thank you.